Metascape.com. Roux-en-Y allows diabetic patients' pancreas to make insulin again. States the article, 2 years of controlling diabetes is gained with bypass. The preferred procedure is Roux-en-Y, as it is best at targeting belly fat. Well, I would say to you, try the banded gastric bypass or lap band first, because in 2 years or more, you'll be facing diabetes again, and probably with issues as big or bigger than diabetes. Imagine trying to control your insulin levels or your glucose levels with a system that does not absorb nutrition well. Taipe news. The heaviest man in Taipe receives gastric bypass and loses 100 kilograms or 220 pounds in 1 year. From digtriad.com, couple undergoes gastric bypass hypnosis surgery, tricking their minds to remember having gastric bypass without the knife. They have shed 75 pounds each. And from Bariatric News, this article is investigation of bariatric surgery with concerns to diabetes. Researchers at Sheba Medical Center in Israel are investigating the effect of weight loss rates on liver's steatosis, which is the abnormal retention of lipids within the cell which leads to fatty liver disease, and steatosis hepatitis, or NASH. It's a non-alcoholic steatosis which happens like liver disease in drinkers. It's often called a silent liver disease. And fibrosis at different stages before and after Roux-en-Y gastric bypass or sleeve gastrostomy in 30 patients. Now, this is not a study that's happened. This is a study that they're going to be doing in Sheba Medical Center. From Bariatric News, another upcoming study examines changes in bone metabolism after bariatric surgery. Duke University is heading a study that will determine the changes in bone metabolism after bariatric surgery in postmenopausal women. The study, which will be supported by the Society of American Gastrointestinal Endoscopic Surgeons, will enroll up to 40 postmenopausal female subjects with class 1 and 3 obesity from the Duke Center for Metabolic and Weight Loss Surgery. Okay, the primary points of the study, called Determining Changes in Bone Metabolism After Bariatric Surgery in Postmenopausal Women. This study are looking at changes in osteoclast, which is bone tissue, activity measured by a C-terminal telepeptide of type 1 collagen. Basically what that is the connective tissues, and changes in bone density as measured by a EDXA scan. Secondary outcome measures include biochemical changes in the bone, which will be determined by collecting serums from subjects preoperative and 12 months postoperative. The serum will be used in the completion of the study to run enzyme-linked immunoabsorbent assay to determine biochemical changes in their bone metabolism. From Bariatric News, waist-height ratio, better predictor of mortality. The study found a clearer correlation between waist-to-height ratio and mortality rates than BMI and mortality rates. From Bariatric News, an article on gut bacteria. This study provided unique and substantial insights into intricate regulation of the crosstalk between the host and Akkermansia muciniphila bacteria. The research provided a rationale for the development of a treatment that uses human mucus colonizers for the prevention of and treatment of obesity and its associated metabolic disorders. Mice on a high-fat diet, which lead them to put on 2 to 3 times more fat than normal weight mice, were fed the bacteria. The mice remained bigger than the normal weight mice, but also lost half of their extra weight despite no changes to their diet. They also had lower levels of insulin resistance. Bariatric News. Study links bariatric surgery and suicide risk. Okay, this one's near and dear to my heart. Bariatric patients are at an increased risk of suicide after their surgery, according to the findings of a new systemic review. The paper, published in Obesity Reviews, estimated that bariatric patients are 4 times more likely to commit suicide than the general population. The paper suggests that some suicides may be linked to weight regain and the relapse of obesity-related comorbidities after surgery, pointing to a study that found that the majority of post-surgery suicides occurred 2 to 4 years after the operation, when such events were likely to take place. I suffered for 5 years with depression. And it wasn't depression, it was depression that I could name. I thought I had a reason I was depressed. And it was due to factors in my life I couldn't control, but not related to my health nor my weight. My thoughts on this article is that maybe that there's more than just to regaining our weight or returning comorbidities we thought we had gotten rid of, which one of those, by the way, can be diabetes. If you're having gastric bypass to control your diabetes and it's returned, that's a given. It's going to, because it's not a cure, it's just a remission. Although I would say that I think a more likely culprit for our depression at 2 to 4 year mark when the suicides happen are malabsorption. And I say that because there's recent studies that say at the 2 to 4 year mark, we are at our lowest nutritionally. Same study shows after the 2 to 4 year mark, we begin to regain our nutrition. Our body kind of compensates and figures out how to get some more nutrition out of the food we're eating. But along with the nutritional deficiencies that we have during that time, we have to look at the fact that many vitamin deficiencies can display themselves as depression. 3 of them that we deal with specifically are vitamin D, vitamin B, and iron. They display themselves when you're low iron, low vitamin B, low vitamin D. They display, one of the symptoms they display as is depression. So we need to keep that in mind. If you're depressed, one of the first things I look at when I start getting depressed, that's not if there's not an earth-shattering event in my life, that's another thing, but if there's not one, I start looking at how is my iron level, how is my vitamin B level, have I been getting enough vitamin D? And I guarantee you, for me anyway, I guarantee you that if I'm fighting depression for no apparent good reason, one of those levels have dropped. That's it for this month of February 2013. Gastric Bypass News. Thanks for joining me.